You know, right now, in the heart of our hospitals and clinics, there's a quiet revolution happening. It's not some new wonder drug or a radical surgery. No, it's a total shift in how we manage our health, and it's all powered by technology. This is a story about data, about connection, and about a future where healthcare is just smarter, faster, and available to way more people.
So that brings us to the big question, right? How is all this digital stuff actually saving lives? How is it changing the day-to-day reality of medicine? Well, the answer lies in this incredibly powerful force that's reshaping the entire industry. And that force is what we call information and communication technology, or just ICT for short. Put simply, it's using digital tools to handle and share health information. Honestly, the best way to think about it is like the nervous system for modern medicine. It connects doctors, patients, and all that crucial data to make pretty much every part of your care better.
All right, let's dive in. And we have to start with the absolute foundation of this whole digital shift. We're talking about solving a problem that has plagued medicine for ages: pure information chaos. I mean, just think about it. For generations, your entire medical history, every single diagnosis, every prescription, every little note was literally trapped on pieces of paper, scattered in bulky files across who knows how many different doctors' offices. This wasn't just messy, it could be dangerous, leading to delays, lost info, and even critical mistakes. And that's where the solution comes in: the electronic health record, or EHR. Now, this is so much more than just a digital version of a paper file. It's a living, breathing, real-time record of your entire health journey. It puts you, the patient, right at the center and creates one single, secure source of truth that the people who need it can see instantly.
And their impact? It's huge, and it's spread across a few really important areas. Look at this. A massive 22.8% of the benefit is just from improving communication between doctors and nurses. Another 22.5% is from better, clearer documentation. And this is so crucial. 21.6% is all about safer medication management, helping to catch and prevent dangerous drug interactions before they can ever happen. Okay, so once all that information is digitized and in one place, what's next? Well, now we can start to tackle maybe the biggest barrier in healthcare: distance. We can start building healthcare without walls.
Now, before we go further, it's worth clearing up two terms you hear all the time. First, you've got telehealth. Think of that as the big umbrella. It covers everything done remotely in healthcare, even stuff like training for doctors. Then you have telemedicine, which is a part of telehealth. It's the piece we're most familiar with, the actual remote clinical care. You know, talking to your doctor through a screen. So how does this all work in the real world? Well, it takes a few different forms. There's the live video call, right? A real-time consultation with your doctor. Then there's something called store and forward, which is where you might send a picture of a rash, for example, and a specialist reviews it later. There's remote patient monitoring, using devices at home to track things like blood pressure. And of course, there's mHealth, all those apps and wearables on our phones and wrists that help us manage our own health. And the human impact of this is just profound. It isn't just about convenience. It's about making healthcare fairer. This quote really nails it. Technology helps overcome geographic distance, and the biggest win is that it allows patients, even in the most remote areas, to connect with top specialists. That's a game changer. So we've got digitized records, and we've bridged physical distances. Now we're at the next great frontier, using artificial intelligence to solve the problems of just too much data and, let's be honest, the natural limits of human perception. The best way to think about AI in medicine is not as some robot doctor replacement. Not at all. It's more like an incredibly powerful, intelligent assistant. It can sift through thousands of medical scans or data points, spotting tiny patterns a human eye might miss. And it does it with a speed and precision that are just, well, superhuman. And the results are absolutely staggering. Get this. Some AI models have reached an accuracy rate of 98.7% in detecting lung cancer on CT scans. We're talking about spotting one of the deadliest cancers earlier and more reliably than ever before, right when it's most treatable. That incredible accuracy has a ripple effect. When you can find diseases that early, when they're easier and cheaper to treat, you can potentially cut treatment costs by up to 50%. That makes the whole system more sustainable for everyone.
And this is so important. This technology supports our healthcare professionals too. AI can take over some of the routine, time-consuming tasks, reducing a radiologist's workload by more than half. That helps fight burnout and lets these amazing doctors focus their skills on the trickiest cases.
So when you put all of these pieces together, the digital records, the remote access, the artificial intelligence, what does this connected future actually look and feel like for us?
The path to better care becomes really clear. It all starts when you digitize the records. That creates the single source of truth. From there, you use telemedicine to basically erase distance as a barrier. Then, you layer on AI to give doctors superhuman insights. And all of these steps work together, leading to one single goal: better outcomes for all of us.
When you zoom out, the benefits are just transformative. We're talking about better, more personalized patient care. We're seeing hospitals that run more efficiently. Quality care is becoming more accessible to people no matter where they live. Medical decisions are being driven by data, not just guesswork. And maybe most importantly, patient safety is getting a huge boost.
But of course, this revolution isn't perfect. It's not without its hurdles. The costs to implement all this are really high. Protecting our private health data is an enormous responsibility, and we absolutely have to make sure these new tools don't leave people behind who don't have access to the latest tech.
But the direction we're headed is crystal clear. This digital pulse is just getting stronger every single day. It's changing healthcare from a series of disconnected appointments into a continuous, intelligent, and connected system. And that leaves us with one final and, I think, really inspiring question. With technology this powerful, what will the future of our health truly look like?